Naturally, we have technical difficulties. It's a webinar. So I'm really happy everybody is here today. I wish I knew how many of you there are, but I think you're all still rolling in, so that's fine. Today, we're really lucky. We get to talk about trees and human health, and that has really become one of the most powerful arguments for why we need trees in our cities near people. So I'm delighted to have Dr. Desiree Bachman and Dr. Neil Kohatsu here from the UC Davis Institute for Population Health, the UC Davis Health System, and inside that, the UC Davis Institute for Population Health, to talk about recent research on why we need trees for human health benefits. As you all may remember, I used to work at Sacramento Tree Foundation. As a matter of fact, Desiree was there and hired me at Sacramento Tree Foundation, and she taught me how to pronounce epidemiological, while Ray Trellaway was teaching me Latin, you know, corpus lobata and that sort of thing. So Desiree was at Sacramento Tree Foundation for 3 years, and she has a long history in the public health field. However, she's a doctor of public health and many other academic awards. She has published research articles on cancer prevention, health promotion, disease prevention, quality improvement, and population health interventions, which I think of trees as a population health intervention. So, but she's also passionate about the environment and how the environment can affect human health. She secured grants and contracts worth over $255 million in her career and has served on a variety of expert panels and work groups at Loma Linda University, the Centers for Disease Control and Prevention, and the National Cancer Institute. Prior to launching her career, Desiree earned her doctorate in public health from Loma Linda University. So Desiree is going to be speaking in conjunction with Neil, and Dr. Neil Kohatsu is a program evaluator and health strategist at the Institute for Population Health. He has an MD. He's also got a Master in Public Health, and then he also has another acronym, FACPM, which I forgot to ask what that was.
Fellow American College of Preventive Medicine.
Fellow of the American College for Preventive Medicine. He also serves on the volunteer clinical faculty at UC Davis. Prior to that, he was the medical director for the California Department of Healthcare Services, where he provided medical policy and analytical support for the Medi-Cal program, which serves about 14 million members here in California, which is a huge responsibility. And he's also held other leadership positions in government in the private sector. He was associate professor of epidemiology at University of Iowa, and 30 years of practice experience. He is also on the editorial board of the American Journal of Preventive Medicine. What I think is interesting about that is, as Desiree first brought more awareness of human health issues into the urban forest world, I can remember being impressed when Desiree wrote a grant and she had footnotes in it, which was the first time I'd seen a grant footnoted, and especially for public health reasons. So I've become much more aware of the health research journals, and we should all be that way, so that when we're proving our points about why trees are beneficial to our communities, we can cite those facts. So at this point, let's just go over a few other housekeeping things. When you have questions, there is a questions box where you can type them in, and we will handle them at the end of the presentation. A quick peek ahead, next month, we're going to have, in late March, we're not sure exactly what day, we're going to have a webinar on trees and jobs. And as you all may know, human health has a lot to do with having gainful employment and steady paychecks. As I've said before, I believe urban forest nonprofits are in the perfect position to let young people know in middle school and high school that they can work in the tree care industry, in taking care of trees, especially for people not interested in working behind a desk, or they can work in nonprofits. So we really want your questions. Please type them into the chat box. And now let me pass it over to Desiree so that she can bring you up to date on trees and public health.
Thank you, Cindy, and welcome aboard, everyone. We're so happy that you're joining us today. Dr. Kohatsu and I are pleased to be with you and to present the Green Prescription, Improving Population Health Through Environmental Interventions. So today we're going to divide the presentation up into several key areas. We're going to start with a brief description of an evaluation project that we're conducting in Sacramento and Yolo counties called KOA Family. The purpose of KOA Family is to reduce the risk and prevalence of overweight and obesity among low-income mothers. And one approach that we're taking as part of the KOA Family program is a tree planting and stewardship campaign. And it's this approach that has prompted the most questions from local, state, and national audiences. So given the level of interest and curiosity on this topic, Neil and I thought it would be helpful to recap some of the environmental co-benefits of trees and our green infrastructure, and then transition into the relationships between greening and health. We're also going to share some recent research demonstrating a stronger causal link between greening and multiple physical, social, and mental health outcomes. And then after we share this research, we'll be spending a little time talking with you about how you can get more involved in linking these powerful health benefits with health-related organizations to grow your mission as well as your cause. Plus, we hope to have a little bit of time left over at the end of the presentation for a rich question and answer session. So before we get started, we want to acknowledge our financial supporters for this work, including CAL FIRE and the Supplemental Nutrition Assistance Program, as well as our collaborators at UC Davis Health, the California Department of Healthcare Services, Davie Resource Group, Lead for Tomorrow, LTG Associates, Marketing by Design, the National Opinion Research Center, and WestStat. So let's turn our attention to KOA Family. So we just launched our KOA Family study and our program just last month. So it's hot off the press. And the aim of our study is to determine the impact of KOA Family interventions on reducing overweight and obesity and improving related behavioral and health indicators among low-income, overweight, or obese mothers in South Sacramento and the city of Woodland. And our research design approach is a randomized controlled trial. And this is the gold standard of research to demonstrate cause and effect. And we are measuring multiple behaviors along the way with the study, including body mass index, which gives us an indicator about someone's weight shifting in a more favorable direction from overweight and obese, hopefully to more healthier weight, diet, physical activity, quality of life, social cohesion, as well as other indicators that are related to our KOA Family approach. Now, we just did our baseline data collection last month, and we'll also be monitoring people's behaviors at 3 months, 6 months, 9 months, and 12 months. We're also going to be doing an economic evaluation to demonstrate cost effectiveness. In terms of our approach, Neil, our collaborators, and I, we spent over a year doing formative research to inform our approach to KOA Family. And we spent this time because it was clear from the data that obesity continues to be on the rise among most population subgroups around the country. And we felt like we needed to take a fresh look at the issue. So we conducted focus groups in English and Spanish with low-income moms throughout California. We did video ethnography research where we followed moms and dads forward in time during the course of a typical day to learn about their daily life experiences. We also conducted key informant interviews with thought leaders and luminaries around the country who are somehow influencing the obesity epidemic. And we did a review of the literature to identify best practices, and we looked at national guidelines and recommendations on the topic. And all of this research was done to really give us, first of all, a wide perspective about health overall and folks' opinions about that and how best to make the investment that we're making in KOA Family. And then we focused our research on the obesity issue itself. Now, based on the results of our formative research, it was clear that we needed to approach KOA Family from 3 main vantage points. First, we needed to create opportunities for real social connection for our low-income moms. They made it clear all around the state that they craved social connection. Oftentimes they felt isolated. And these were young moms as well who were expressing this, and that they needed support, human connection, more connection in their communities. They also told us that we needed to approach obesity from a whole person perspective, that in order to be effective, that we needed to really approach the situation, including the mind, the body, and the spirit. And with that in mind, we created a 22-week whole health program where moms meet for 90 minutes in small groups each week to not only experience nutrition and physical activity, which would be the likely candidates for an obesity reduction program, but also to learn how to overcome adversity and build resilience, develop a growth mindset, build healthy relationships, even learn how to sleep better, cope with the ups and downs of life, and build a sense of real empowerment, and also have a voice in transforming their communities. Now, some of the content from the whole health program does come from evidence-based programs, but there's quite a bit of the content that was newly developed and tested. Second, we created a communication arm to KOA Family so the moms would experience ongoing connection and support. And specifically, we're sending text messages 3 times per week to reinforce the content of the whole health program. And the moms also participate in private Facebook groups to encourage sharing, support, resilience, empowerment, and action. And finally, to change the neighborhood for years to come, our study participants, along with community volunteers and local organizations, will be planting, growing, and stewarding a total of 300 trees, 150 in each community. So as I mentioned, as Dr. Kohatsu and I are presenting this program and the work that we're doing to a variety of audiences, one of the most important questions that we get and most frequent questions is, okay, we kind of get the programmatic piece with the whole health program and the communication. So why trees, and how does that fit in? And we use that really as an opportunity to educate folks about the powers that trees have in our lives. So for years, there has been a nice investment of time, energy, and effort made in understanding and also monetizing the environmental benefits of trees and our green infrastructure. And these are all familiar to all of you on the call today. Such benefits include improving air and water quality, mitigating the urban heat island effect, and reducing our energy use, reducing exposure to damaging ultraviolet radiation, alleviating noise, improving our property values and commerce, providing wildlife habitat, and so much more. The environmental narrative on this issue, scientifically and policy-wise, has been powerful over the years. And now we've got this other piece of the equation that is powerful as well. More recently, we've seen a lot more research that's been conducted to understand the physical, mental, and social co-benefits of greening. In fact, this slide displays some results from Peter James and Associates' work. They did a review on the health benefits of greening, and they noted many promising links. So the first one you'll see here is physical activity. There is consistent evidence, fairly consistent evidence, demonstrating a positive association between greenness and physical activity. In other words, exposure to more greenness is linked to more physical activity. On the overweight and obesity front, there is some evidence that exposure to more greenness is associated with less overweight and obesity, though the findings, especially among our kids, are mixed. In terms of mental health, there appears to be a strong connection between our exposure to greenness and self-reported mental health in a positive way, in a protective way. This includes reduced risk of stress and fatigue, propensity to psychiatric morbidity, depressive symptoms, and clinical anxiety and depression prevalence, as well as, on the positive note, improved attention, restoration, as well as social cohesion. Next, on the birth weight front, there's consistent evidence of a positive relationship between greenness exposure and birth weight. And greenness also tends to be linked quite positively to our heart health, our cardiovascular outcomes. In fact, there's fairly consistent evidence of higher greenness and lower cardiovascular disease. And also a fairly consistent evidence around higher greenness and lower mortality. And then when we talk about inequalities, it's really the tale of two stories here. On the one front, if you live in a lower resource community, you tend to have lower access to green, which means that there's an enormous opportunity to do more greening in those neighborhoods. But on the flip side is that when a greener infrastructure comes into these communities, the health benefits and the health outcomes tend to be even more powerful. So next, I'd like to turn the conversation over to Dr. Kohatsu, and he's going to share some observational studies as well as randomized controlled trials that are showing a powerful now cause and effect relationship between our green infrastructure and health outcomes on multiple dimensions. So I'm going to turn the conversation over to Dr. Kohatsu.
Well, thank you so much, Desiree. It's a pleasure to be here with all of you. So to give you a feel of this rapidly advancing body of research in the area of greening and health, we'd like to highlight a few specific studies. And why don't we begin with a couple of observational studies? We're going to be touching upon several of the themes that Desiree just mentioned in that very nice review article. So the first project that we're going to talk about was a cross-sectional study. It examined the relationship between neighborhood greening and the burden of chronic disease. The study population was large. It was about 250,000 Medicare beneficiaries, so seniors in the Miami-Dade County area. They looked at scores of chronic conditions, the researchers that is, and assessed among them diabetes, high blood pressure, and high cholesterol. What they found after completing the analysis was, for this study population, they found that living with higher levels of greening was associated with fewer chronic conditions, including those associated with obesity and tied to the leading causes of death, particularly cardiovascular disease. Interestingly, the relationship they found was stronger in low-income neighborhoods. In the second paper, almost 110,000 women in the Nurses' Health Study were tracked forward for 8 years. The purpose of this study was to see if there was a relationship between neighborhood greening and mortality. After adjustment for age, race, ethnicity, smoking, and socioeconomic status, it turned out that the women in the greenest quintile had a 12% lower all-cause mortality rate compared with those in the least green quintile. Now, an interesting fact was that the association was robust, meaning that it was strong regardless of race, ethnicity, physical activity, smoking, socioeconomic status, weight, and geography. There were women in the study from all of the 48 continental United States, urban and rural areas were represented, and this relationship was strong across all of these variables. So let's now turn to a couple of randomized controlled trials, or RCTs as they're often abbreviated. As Desiree noted, RCTs are widely regarded as the most rigorous research design when executed properly. This first study was entitled The Effect of Urban Greening on Mental Health, a cluster randomized trial. The purpose of the study was to determine whether interventions to green up vacant lots could improve depression as measured by a standard community screening tool. Now, there were two intervention approaches used in this study. In the greening intervention, trash was removed, the sites were graded, and grass and trees were planted. In addition, a wooden low perimeter fence was installed around each of these designated lots in the greening intervention. The second intervention arm was called the trash cleanup intervention. In this, trash was removed and there was limited grass mowing. The control sites did not receive any of these services. So overall, there were a total of 110 vacant lot clusters, including 541 total vacant lots. They were randomized into 3 arms. The greening arm that I discussed had 37 lot clusters. Trash cleanup had 36 clusters, and the control 37 clusters. In these vacant lot areas, in the study areas, there were almost 450 community dwelling adults. After the analysis was completed, it turned out that the greening intervention, but not trash cleanup alone, was associated with a decrease in the prevalence of depression. Of note was that the vacant lot greening only cost around $1,600 per lot, and it was estimated that the yearly maintenance was less than $200. Now, why is that economic analysis important? Turns out that about 15% of land in urban core in U.S. cities basically are composed of vacant lots, land deemed vacant or abandoned. So the fact that the trash cleanup, the greening in particular, was relatively inexpensive and could be done on a mass scale is very important for policy development. Let's take a look at a couple of examples of the greening intervention. So each reading across, these are 2 examples. On the left photographs, you see the before state. The one in the lower left, perhaps a stereotypical vacant lot in the urban core, pretty scary area. You could see in the middle panels, in the middle photos, what went on during the restoration. You could see the grading. And finally, you see the final state. And when I look at the lower right photograph, in the bottom right, it looks to me like they created a little mini urban park, and that, of course, was the idea. So this next study that we're going to talk about looked at the impact of community greening on crime and the perception of neighborhood safety. It had a very similar design to the previous study. It was also done in the same area of Philadelphia. There were 541 vacant lots in this study. They were randomly assigned to just 2 conditions, either the treatment intervention or the control intervention. The intervention arm consisted of trash removal, grass and tree planting, and the installation of that low wooden perimeter fence, which you saw in the pictures, again, creating essentially mini parks. The control areas, however, received no services. When they analyzed the data and looked at the results, the greening areas showed reduced fear and enhanced feelings of safety among the residents. They also showed reductions in police-reported violent crime. So there was alignment between the increased perception of neighborhood safety, and actual quantitative data showing reduced violent crime measured by police reports. I'm going to talk about one more study, which combines some of the aspects that Desiree talked about, traditional environmental health impacts, along with broader health and social impacts that trees may be able to create in the right communities. The study we're going to talk about is called Green Heart Louisville. Before I dive into the specifics of the study, a little background on Louisville. So the city of Louisville received an F from the American Lung Association, which ranks states and areas, and the Lung Association gave Louisville an F for frequent high ozone days and very poor air quality, among the worst in the state. In addition, other observers noted that the tree canopy in Louisville was sparse, particularly in low-income neighborhoods. So a very diverse set of partners got together and said, we need to do something about this for our residents in Louisville. Those partners included the Departments of Medicine and Environmental Health at the University of Louisville, the Nature Conservancy, Louisville Grows, a regional not-for-profit, Washington University of St. Louis, which focused on air quality, an urban design lab in California, and the United States Forest Service. They got several $1 million of National Institutes of Health research funding in addition. So what did they do? What did these partners do, or are they doing in the Green Heart Louisville study? Well, it's a community-based longitudinal study looking at the impact of urban greening, as I said, on both environmental and other specific health outcomes. In the area of the environment, they're doing some very novel research, not just planting trees, but they're looking where trees are planted, how they are planted, to see how the removal of air pollution can be optimized. In addition, they're looking at some of the health factors, obesity, diabetes, and heart disease, some of the most common chronic diseases facing not only those who live in Louisville, but Americans in general, and seeing how enhancing urban greening can impact these chronic diseases. They're looking very broadly at health, looking at mental stress, social cohesion, physical activity, as well as, similar to the other studies in Philadelphia, crime rates, property values, and also traditional environmental health outcomes, impact on stormwater runoff, energy use, and heat island effects. This study is well underway. Baseline measurements have been already conducted, and they are literally in the middle of doing the intervention, planting thousands of trees, shrubs, the urban greening, grasses to create a sustainable ecosystem. And they won't be done and reporting out for 2 or 3 years, but a very exciting study of what can be done to look broadly at the impact of trees. So where do we go from here? Let me turn the program back to Desiree, who will share some of our reflections. Desiree?
Thank you, Neil. So, there's so much opportunity. I think in the conversations that we have in our own offices, it just seems that the science and the opportunities here for trees and the broader greening approach, the time is really ripe for that. So when we talk to population health, healthcare audiences, we have 4 key messages for them, but these are messages that already resonate with the work that you do day in and day out. The evidence is clear. We need to continue to plant and grow and sustain our urban and community forests and our green infrastructure overall. There's so much more work yet to be done. And scientifically, we need to remain curious, and we need to continue to explore, to grow the science, to monetize now the health benefits that trees and greening have to offer us. So there's still so much room for opportunity and so much room for growth. And now we've just got good science behind it. So one of the things that Dr. Kohatsu and I thought might be beneficial in our conversation together today is, since this health connection continues to grow more strongly and the science and the rigor of the science continues to gain strength over time, that it would be instructive to offer some ideas on how best to connect the health sphere with the greening sphere, so that those 2 things can really harmonize together. And at least in our line of work, what we have found along the way is that the connection in these different worlds sometimes is not as clear-cut as we would all hope it to be. And so one of the things when we were designing KOA Family, for example, is we wanted to meld these worlds together, because oftentimes the health world even uses different language than our urban greening world. And sometimes that language barrier can get in the way of forming good partnerships. And quite frankly, in our areas of influence, oftentimes folks just don't know about the benefits that trees in our green environment actually have. I think intuitively there's a connection, but they don't know how great the science actually is. So some words of advice on our end is to really think about your local health departments. The local health departments have a broad connection in the community, and they're generally interested in promoting partnerships that advance health and well-being in the community. So we all have kind of a shared interest in improving the health and well-being of neighborhoods, large and small. But there's a lot more effort that needs to be done to actually connect with local health departments and fully optimize what they have to offer, and to do some joint work together along the way. Another group of interest are local health foundations. So right here in Sacramento, we have the Sierra Health Foundation, and they provide grant funding serving Sacramento as well as counties northward. And these local health foundations are increasingly taking a more broad view of health, including issues related to urban planning and the physical environment. So opportunities may start to surface more than we've seen before with these groups. There's also leaders in community clinics, such as the CEO who runs the clinic, the chief medical officer. So as Cindy mentioned, Dr. Kohatsu was the medical officer for the large Medi-Cal program at the state level. These are the types of folks that we need to connect with, and they may be very useful allies to advance policies that are conducive to urban greening, especially once they get to know the science as we've talked about it today and beyond. There's a lot of science out there. Next are your not-for-profit hospitals. They are, by law, they must reinvest what would be profit right back into the community. And while many facilities have done this through free or low-cost clinics, a more public health view, a population health view of community investment is becoming more common. So an example of that would be the hospitals are thinking about ways in which to sustain a healthier community. So they're thinking about social determinants of health. They're thinking about jobs and food security and education, transportation, the things that play such an important role in our health. Oftentimes they spend a lot of time treating all of us to try to make us be well when we are ill, but really they're starting to think about the role that they could play in the broader conversation around these social determinants of health. And then that brings us to other not-for-profit organizations beyond urban forestry entities who may be willing to partner on joint grant funding. So an example of that would be housing advocacy groups. They're paying much more attention now to quality of life issues, and certainly trees in our green infrastructure plays a part of that, that could address, our health and well-being. So we find ourselves, as I mentioned, in an interesting set of circumstances. It's truly our time. We've got strong and growing evidence base that is not only linking greening to health, but it's also showing a causal relationship between those two things because the science has become more rigor. And we combine that with a public health and a healthcare infrastructure that's already in place. And what all of that points to, it appears that the time is ripe for more collaboration and more partnerships amongst all of these groups to enhance our green infrastructure, and in so doing, improve the health and well-being of our global family as well as our planet. So Cindy, that concludes the more formalized part of our presentation, and I'm going to turn it over to you.
Wonderful. Thank you very, very much for all of that as far as information. It was fascinating to hear the latest results. I think we want to emphasize that term randomized controlled trials, because Desiree was the one who explained to me a couple of years back that that's the gold standard. A lot of times I'd gotten up and talked about some of the studies I'd read where there was correlation, but it wasn't causality. but this is where you get the causalities with the randomized control trials. And so we need to keep that in mind and keep that in your vocabulary toolbox when you're talking to various people. Right now, I don't see any questions on my computer. I'm going to check like by talking out loud to see if Mariela has any questions on her computer. But I have a couple questions to get this started. And some of it stems from when I worked at Sacramento Tree Foundation and was working more in the local neighborhood versus statewide. Desiree, when you talked about working more closely with the health departments, the local health departments, I was at a talk recently and they were talking about local health departments at one point were really here to handle like infectious diseases, right? Like when we had outbreaks of things. I won't mention coronavirus, but that would be the sort of thing. But then somebody at this talk said, well, infectious diseases weren't necessarily their top priority. It was becoming chronic diseases because of the obesity epidemic, et cetera, happening in the US and elsewhere. So there is like a health officer at the top of that organization. If I were to walk into a local health department, is it better for me to go look for somebody who is the health officer, or is it better for me to talk to somebody who's in charge of community health per se? And Dr. Kotz, what do you think?
I'll just try and, we're sharing the speakerphone, so please write in if you can't hear us. I'll try and speak up. Cindy, that's a great question and really goes beyond local health departments. I think that's a question that is applicable to the other channels that Desiree talked about. So just from experience and not from an RCT, my own experience is go to whatever and in multiple levels reaching out. Sometimes it is the leader. It may be the health director who is different from the health officer, maybe the physician. Now it's often split roles where there's a chief administrative officer who's in charge and oversees the budget. Used to be one and the same. So in some sense, if you've seen one health department, you've seen one health department. There's 61 health jurisdictions. There are 58 counties. Each one has a health department, and then there are 3 Berkeley, and there's one in Los Angeles. So certainly feel free, if you know someone in the leadership group, that would be good. Sometimes people who have a community out-facing role are the health educators, and they are in the community. It could be someone else. It could be any connection that you can start with. It is useful when you're trying to work on policy to get the highest level that you can reach. But the most important thing is if you have a personal connection or someone you know, maybe even a neighbor, start there and then work your way around the organization. I think the general comment is that personal connection, building that sense of trust, is the most important thing, not necessarily where they are in the organizational chart. Desiree?
Yeah, and just remember too that in these conversations, folks in local health departments, they're thinking about the science all the time, the best evidence base. So when you approach in building that relationship, come prepared with the type of evidence that we talked about today, and there's still a lot more out there. We just sort of touched and skimmed on the tip of the iceberg. Because that's the language that they speak. They want to know about those best practices. They want to know about how the co-benefits have been monetized. And certainly there's some evidence there around the environmental piece, these randomized controlled trials. This is the type of thing that they'll be looking for in having a better understanding about how what you do fits within the confines of what they do and finding a point of joint intersection where collaboration becomes more possible.
So it's the proof, right? It's really saying this is the proof of why you should work with us. Here's the scientific.
Exactly. And, you know, and it's kind of the sleeper. As I mentioned, Neil and I have experienced this around the state and with other collaborators with whom we work. When we talk about trees, it's surprising to us how much of an aha moment folks in the healthcare and public health community actually demonstrate to us. it's a bit of surprise. And it's like, well, we knew it was good, but we didn't really know how good. And the other part of it too is there seems to be a lack of understanding about the role of our green infrastructure in trees and the multiple dimensions of health.
Okay.
So when you talk about the physical health, the mental health, the social health, it's really touching on all of these key dimensions. And, you know, much of the time, the work that we do in population health improvement and healthcare doesn't really speak to all of those things simultaneously. So the fact that our green infrastructure does is a real plus in talking to this community.
One other thing I would add, to get that first appointment, which can be the most challenging, how do I break through? And I've walked the halls of Congress on behalf of prevention and public health, and certainly in the legislature, having been in state government for a couple decades at one point. And same at the local level, is bring one of your community leaders with you. You've done a project maybe with a school, with a faith organization, or some combination. Do a joint appointment, and they will speak as the voice of the community with you in partnership. That is why government is there. Now, that doesn't guarantee a reception, but I can tell you from my own experience, it certainly helps get you in the door. So you have those connections, bring them with you and say, with me is this community leader, and we did a joint tree project. They want to tell you about that.
Yeah, you just
gets you in the door.
Exactly, you just put the public and public health right there.
Yeah.
Because they're very interested in their constituents and the people that they're charged to serve.
At one point, when we were talking about public health, and we were also talking about the cap and trade or greenhouse gas reduction fund grants, somebody said to me, why have we not engaged the public health department more in these grants? And I think part of it, I think it's one thing to go to somebody and say, we have money that we can share with you, which always gets everybody excited. It's another thing if you don't have money you can share with the public health department, but is there some other way, instead of saying you're one of the fundable partners in this, is there another way to say, we're going to be doing this, is there some kind of experiment, or how do you engage them without actually having dollars to give to them?
Exactly. Yeah. So that's what we did with KOA Family. So we wanted to create that bridge, and so we just acted as the in-between actor, and we drew down the USDA SNAP Ed funds, which is mainly to do nutrition education with low-income populations. And then we worked with our friends at CAL FIRE to bring in the tree piece, and through demonstration, they get to see that a co-investment can actually create a bigger return. By having these two funding sources come together, and we are at UC Davis doing this work, it kind of shows how the two things come together. And what we're hoping is that through this demonstration, that then, now we can start to think about, you know, how does funding actually get blended to achieve a bigger return by having multiple partners come together in the aim of improving health. So that's kind of how we approached it with KOA Family, because the funding link was not natural at the beginning, so we're taking that first step into it.
Yeah, I think that's absolutely right, and I wish it were true with every health department. It probably isn't, but many do want to be facilitators. Yes, it'd be great if there's a grant, but their job is to say, I can bring in the private sector, I can bring in the schools, I can connect you with some of the funders, or maybe we can go after a joint grant. And yes, they are strapped for funds in general. That being said, they can't themselves do direct service in many areas. Many have cut back almost all their clinical service, so their role has changed. I have actually been approached by the local health officers to talk about how do we talk with healthcare. I hope I get invited back so I can bring Desiree in and say, how do we talk about urban greening? It's one of the things that we want to bring to them, and that can be another conversation perhaps on the webinar.
So excuse me, this idea that they want to be facilitators is really good news. And I guess I want to tie that back to something you said, Desiree, when you said that, CAL FIRE gave the money for the trees, but then there was the SNAP Ed funds. And I get the impression that UC Davis brought in the SNAP Ed funds, but I don't know, medical stuff or health stuff. can the local health department bring into play the SNAP Ed funds? So they could somehow engage that way?
Good question.
That's a great question. And yes, so at the state level, the way the SNAP Ed funding works in part is that a fair amount of dollars goes into the California Department of Public Health, and then the California Department of Public Health works with every single local health department to do this SNAP Ed work, nutrition education at the local level, with the local health departments being the delivery mechanism for that. So there's quite an infrastructure in place, a SNAP Ed infrastructure that is delivering nutrition education at the local level through funds that get passed through the Department of Public Health. So it's a nice connection between state, local health departments doing nutrition education. So the funds are there for that purpose. What we did is we just took it a different route. We secured those dollars from SNAP Ed directly through our partners at the Department of Social Services. And because of our love for trees and our green infrastructure, we brought CAL FIRE in to help put those two things together. But the project itself is a manifestation of all of those inputs that includes a public health approach with trees.
So this also harks back to the project that you did when you were at Sacramento Tree Foundation, where you knew that there could be money, like we had the fruit tree project, right? Mm-hmm. And the fruit tree project was where we planted trees, gave away fruit trees, and we did some nutritional education. As a matter of fact, as part of that, the grant money came from something else.
Quaker Oats.
And then the money for training people to understand about nutrition came from SNAP Ed. And I think that is a good role model in this. Certainly, when we started working on the Greenhouse Gas Reduction Fund grants, and we had the Green Innovation Grant, which was going to be things other than just carbon sequestering trees, we had an outpouring of interest in the low-income neighborhoods about fruit trees, right? And fruit trees do not sequester a lot of carbon, so that kind of got set aside, right? What we say to people with our grants is, okay, plant quite a few oaks, big ones, and then plant some fruit trees. You know, you can plant a multi-level forest. So this might be a way to go after funding for simply for the fruit nutritional aspect of it, as well as some shade trees so that they can walk under them, and then tie in the education. Cool. The other thing I wanted to ask, oh, wait a minute. We did get a question, and I needed to, the question that came through was more of a request. It says, it's great to hear all of this new research that are indicating correlation between greening and better health. I'm imagining having conversations with my local elected officials or health professionals, and it would be helpful to have a capsule list of health benefits that we could quote from excerpts. Does something like that exist? You know, having done this sort of thing for a while, there have been various lists at various times. I think the thing that has to happen, a long time ago, one happened when Alliance for Community Trees was back in DC. But I think at this point it needs to be updated on what the health is. And so California Relief, we'll look into that to see what we can pull together with Desiree and other resources. And, you know, I think we're back to those footnotes that you can use in your grant proposals. And so that you can quote those peer-reviewed journal articles. Great question. Thank you very much for asking it. The other thing I wanted to bring up was when you were talking about the project in Philadelphia, where it showed that crime had gone down. You know, this whole thing about crime has been very controversial, right? Because a lot of people have said some people are afraid of people being behind trees versus reducing crime. Another guy I talked to who was a police officer said it's really about lights. We need to have enough light so that there's lighting. But what was interesting in what I was reading was that it wasn't just the block where the park was, or the mini vacant lot turned into a parklet was. It was the whole neighborhood, right? So it wasn't around the corner.
That's right. They actually looked for that specifically. It's a good point, and they thought about that area, as I mentioned, according to criminologists. Vacant lots are actually where crime is done, and that's it's a big drug dealer hangout, or vacant lots. by transforming into what I described, I don't think they used the term, but they looked like to me like mini parks, on their own, organically. People literally started bringing lawn chairs and play equipment and picnic tables and umbrellas and started using it like a mini park. So there were more people there. Certainly in the summer, they were there in the evening. That is a deterrent. That is exactly what criminals do not want, was a bunch of nice families walking around who are witnesses and like, we're not going to do that. And so why was there a broader reduction? Why did they not move over just a few blocks? It's not clear. Hopefully it means that there was a broader societal transformation. There was a different feeling, and that they didn't study that. But that's the point, is that they deliberately look for just migration of the crime 2 blocks over, and they did not see that. So it suggests that there was something going on, and as I said, a measured feel. 450 some residents said, I think it's safer. And in fact, the crime statistics back that up. Just as something while we're talking about public health, the Institute of Medicine said public health isn't just governmental public health, your local health officer or the state health department, kind of who we think, well, who's working on coronavirus, CDC, that's what people think of generally. Public health is relief, public health or schools, universities, clinics, businesses, everyone contributes to public health. So our whole discussion of how do I approach someone is look for, it's the faith community. So for example, I'll just give you a specific example. In my church in Carmichael, where my family attends, we had 5 trees that we planted in the parking lot, Sacramento Tree Foundation. One of the things that, and now they're big, healthy trees and having that impact. So churches are often connected to the community as well. My pastor happens to know a lot of leaders, including the mayor, and meets with leaders. So that can be a channel. If you've done something with schools or faith organizations or anyone else or businesses, businesses sometimes, I know where I grew up in the Bay Area, they did tree planting to enhance the business district. So bring that leader with you to your other meetings where you're trying to bring others into this, and who knows where it'll go. Often start with where that positivity resides. And so all the things we talked about, local health departments, really applies to these other community entities. Any place in society, they probably can connect up, and maybe they know someone on the hospital board, and then maybe it's called snowball sampling in epidemiology, where you start with a lead and then it snowballs because you say, do you know anyone who might be able to join our work in South Sacramento or wherever your neighborhood that you're targeting? And it's kind of fun that way. It also is just realizing that leadership resides in different areas. It could be a community leader, it could be the faith community, it could be healthcare, it could be government, or all of the above, and it's really unique to your particular area. So that's kind of the fun part, is like you know your community, you know your communities, your county, your areas, and that's why you're best poised to get something launched in these other channels.
I absolutely agree. That what's interesting to me is that we've been working with Edison International in Southern California because they want to start more community groups planting trees in San Bernardino County, and the groups that we've approached are largely faith groups. So
there you
stewardship,
go.
And we've also gotten some community health groups, local community health groups, as well as a boxing club. We've gotten a lot, a cross section, right? It's kind of like when public health is everybody. It's like trees are everybody, right?
Yeah,
trees are everybody. So
good point.
Cool. I knew I had another question, but I'm having a hard time remembering it. Is there anything else that pops to mind as far as questions? I'm looking. Okay, guys, bear with me as I deal with the questions thing. We've got the create one pager. I'm trying to see if there's any other questions, but I don't think I have any. Oh, I know what it was. What was fascinating to me when I talked to somebody from Philadelphia a long time ago, when they were first starting the vacant lot planting, and I said something about, okay, you're going to do all that And for some reason, I thought people were going to put it behind fences, like to protect it or whatever. And they said, no, what we're putting up is just a low little wooden fence, like in the pic. Yeah.
Yeah.
And so I thought I was glad that you had those in the pictures. That it's this fence that doesn't really keep anybody out.
No,
and I'm assuming there were gates. I couldn't see the gates in the photos, but
there are areas you can get in.
And I thought that fence is almost just like a decorative thing to say we care about this. I mean, if you just put the grass and you didn't have the fence, so the fence was a key component of exhibiting care.
Exactly. It also gives it the feel of a park. You often, in fact, I see that in my own, in Carmichael Park District, you see something like that. And in a concrete way, or excuse the use of the word, but
in a wooden way.
It stopped people from literally backing up. Anyone who's lived in an urban area, I spent some time in Chicago, they back up a car or a truck and dump all kinds of garbage. So you can have, it's pedestrian accessible, but it stops that. I mean, no one is going to plow through that, or, you know, it'll probably be on some camera. So it had, let's not turn it into a dumping ground, putting all your mattresses in there, right?
Right.
With all the other positive things that you said, Cindy, as well. So it was really well thought through, and I thought it was very economical for the cost and the maintenance to do that. And I really think that should be replicated. So that's probably something that could be done right now, because you have an article which estimates the cost, and obviously that needs to be done, you know, right in California, but seem to be very reasonable. And I bet you could get neighborhoods really supporting that and get businesses to say, this is great.
Okay, so I did come up with another question, and that was when we were talking about Louisville, and Louisville was doing this thing where they're planting thousands of trees. You know, being a tree person, I was going, well, how many thousand trees? But and then it talked about that they were going to be measuring what the air pollution impact was. But they're talking about doing that within a 5-year window, which is like is there a serious expectation that trees would have made that much impact in 5 years as far as air quality?
Well, I do know that that's Washington University, St. Louis, so they're actually going to use instruments to measure air pollution, and obviously they're probably planting more than 5-gallon trees, because they're looking to deliberately planning on roadways and different patterns, and that's not my area of expertise, but I did see some of the other articles on that. So the answer is yes, they are actually doing instrumentation, and perhaps even with the smaller trees, they're able to see the impacts at an environmental health level. But they have a group specialized in air pollution to look at that, as well as a California group, as I said, on urban planning. And it's funded, some of the primary funding comes from the National Institutes of Health, the research organization, from the Center for Environmental Health. So I think the answer is yes, they're actually taking instrument measurements and looking at where you plant relative to roadways and things of that sort. So I don't know if they're probably doing soil samples and other types of things. I don't know the technology.
Are there articles, you know, we're talking about having bullet points, right? And that's one thing, but on the research side, are there articles available on the Louisville project right now that talk about the details?
I haven't. We can look for it. Typically a study of that size, they publish their what are called methods papers, meaning we don't know the results, but this is what we're doing. So I haven't seen that yet, but in partnership, we can certainly look for just key references that can be shared.
Okay.
So why don't we put that into that other assignment that you mentioned?
Cool. Great. Thank you so much for this
you.
Wonderful presentation. If anybody has any other questions that they think of after the fact, you could always email me and I'll get it to Desiree and Neil, or I think we've got their emails on the presentation as well, which will be posted. And of course, this is being recorded. And we hope to talk to you soon. Thank you so much.
Thank you.
Bye now, everybody.